Welcome to North of 60. I'm Heidi Schweighoefer. Today we're going to talk about home health. I have as my guest Breanna Buterbaugh from BAYADA Home Health Care. Oh, I'm so glad I got all of that out. Breanna, tell me a little bit about yourself and your company.
Sure, I'm really happy to have this opportunity today.
Thank you.
The story of BAYADA Home Health Care is pretty interesting. Mark BAYADA founded the company 45 years ago, and he started with a handful of employees in one small room in Philadelphia, and he was able to grow the company over the years by really staying committed to his vision, which is compassion, excellence, and reliability. So as he selected employees, he made sure that they were committed to those values as well. And he had this unshakable dedication to making sure that every client's needs were thought of first and really valuing his employees as his greatest asset. So through that, he grew because he ended up getting a really good reputation, and people felt really committed to what he was doing. And now we're in 23 states and 5 countries.
No kidding.
Yeah, he has over 33,000 employees. We served our millionth customer, our millionth client this year.
Oh, I think that's just wonderful to hear.
Yeah.
And the values remain. Is that a very important part of your mission locally?
Yes, in fact, he worked really hard at realizing that there was a common theme with everyone that he was bringing on to the organization, and solidified that in what we call the BAYADA way, which is our culture, our mission, our values, and it's something that we talk about daily, weekly in meetings.
Kidding.
There's a whole process as we hire people to make sure they feel very connected to those values as well. So it really helps as we grow to keep us grounded in what he founded originally.
Sure.
And he, it's been 45 years since he started the business. So this year, a few years ago, he started planning for his retirement and what was that going to look like and how was this company going to continue to be a part of the community.
Right.
And he decided after a lot of research with other companies, of course he had offers to sell, and didn't want it to become a company that was based on financial gain.
Good.
And decided to do something that very few companies have ever done, and went from a private organization to a nonprofit. So as a company, we're really excited this year to become a nonprofit organization. And so to maintain those values, we now have a board that every decision that's made makes sure that it is committed to our BAYADA way culture. And it's just really exciting to be a part of this organization.
I have never heard of that before. And then
Right.
you can accept donations as well because
Correct.
you're a 501c3?
That is correct.
That is
Yes.
just absolutely wonderful.
Yes, it's really
Now let's
exciting.
talk about your local. Then you are headquartered where, Breanna?
Well, our office is in Cuyahoga Falls, which is another interesting story of really myself and how I came to work for BAYADA.
Yeah, please.
I am an occupational therapist by background, and I worked as a director when I lived about 7 years ago in the Philadelphia area in an office
As a
that was
director of BAYADA.
Right,
Okay.
so I was a director of an office in Delaware, and found that I absolutely love the company, because of everything I just said and the BAYADA way. Just felt like it really aligned with my personal values a lot and wanted to be there for the rest of my career. However, life happens, and realized that I needed to move for my family and make that decision to move to Ohio, and there was not an office here. So we stayed connected, and when I was ready and when the company was ready, we decided to open an office here to just further grow the company into Ohio and be able to provide that to the people that live here. And it'll be 2 years in April that the office has been open.
Congratulations.
Yeah.
That is a big leap, and it's a very brave one.
Yeah.
Now, what are your service areas, and how big is let's speak locally.
Sure.
How big is your local office and the kinds of employees you hire and that sort of thing?
Sure. So the service area that we provide care in is Summit County and really all the surrounding counties. So we go into Cuyahoga, Geauga, a little bit into Medina, Portage, Canton, a little bit into Canton. So really all the surrounding counties.
Okay.
What we provide service-wise is we do skilled nursing, physical therapy, and occupational therapy. Also have a little bit of social work and a little bit of home health aides that we provide in people's private homes or in assisted livings or independent livings. So we come to our patients in their own homes and provide those skilled professional services.
Now, can you, I think I know I talked with you before we started the show that I'm familiar with home health because of my parents. And I'm not sure I know the difference between skilled nursing services and what? Unskilled?
Other
Other services.
Yeah, so what our professional services are the nurse goes in to see someone and they will do a full assessment of every system of your person, and they'll do vital signs. They're basically an extension of what the doctor does in the office. So they're looking at medications, how much you know when to take your medications, do you need assistance in education on why you're taking those medications, do you have a disease process that's new to you that you need education on, if you have congestive heart failure or diabetes. Or had an orthopedic surgery, or anything where you would need some medical monitoring in the home. To really, the goal of what we do is to prevent hospitalizations, is to prevent people from having to go to the hospital. So we provide that, and the physical therapist provide physical therapy right in the home, or occupational therapy right in the home. And the other services that are also provided in the home by other companies are usually home health aides in shift type care, where they'll come out for 2 hours or 4 hours or 24 hours a day. And that's a different type of service that's provided by other companies that we work in partnership with.
Now, when your nurse goes in and does the initial assessment, then is she the one who would bring on OT, PT, and perhaps come back and say, I think this person would also benefit from a home health aide twice a day or something?
Yes. Everything that we provide care-wise is ordered by a doctor. So a doctor has to oversee what we are doing.
Okay.
And sometimes the doctor will make those recommendations and order nursing, physical therapy, occupational therapy to be in the home. Or sometimes they'll just order nursing, or sometimes just physical therapy, and then that person after the assessment will make recommendations to the doctor to add services if there's something else that's needed.
Okay.
Oftentimes we'll add, say to the doctor, we want to add a social worker, and our social worker will be the person that helps get people assistance with transportation or med management, or if they need home health aides that need to come into the home, she'll help coordinate all those services or access their VA benefits or do POA and kind of estate planning and get people connected with those resources. So she's a really good asset to anyone that's in the home and is having trouble getting out and about.
So that the social worker and nurse and physician can really become the core of the healthcare team.
Correct.
And now let's say the nurse does the assessment, and I'm going to use my parents, I'm sorry, as an example, but my mother was in a wheelchair, my father was not, although on a walker, both in their 90s. My mother needed a lot of care. My father did not so much, but was confused with medication. So in a case like that, would the nurse be coming in every couple of days or every week, put together med boxes? How does that work?
So it really is individual. We create a plan of care based on the individual person's needs. So based on the assessment and someone's insurance. So the services that we provide are usually 100% covered by insurance.
I wanted to ask you about that.
Occasionally there will be a copay or deductible that needs to be met, but that's something that we have to disclose prior to providing services. But under Medicare, it's 100% covered.
I had had no idea.
Yes, a lot of people don't. It's really an underutilized service that people are entitled to after paying into their insurance for many years. And it's really something that, we're trying to get the word out there so we can help people be proactive in their medical care.
Right.
And not have to go to the hospital to get care when it's too late and things have gotten out of control. But back to your question, often the nurse will come once a week, 2 times a week. Sometimes it can be more than that if someone has wound care that needs to be done. Sometimes that can be 3 times a week or up to 5 days a week. It is meant to be intermittent as part of the regulations that we have to follow. So it's not something that's done every day by one discipline. But often when they have nursing, physical therapy, and occupational therapy, we could be there almost every day with one of those disciplines checking in on our clients.
And how often do you do a reassessment? So how often might you be there, 10 years or 2 years or 1
Great
month?
question. So we have 60-day certification periods where we have to reassess every 60 days. Usually the length of time that we're providing care to people can average between 30 days into 60 to 90 days is kind of the average.
Okay.
Really depends on the individual's needs because it's really tailored to that person and what they need.
Let's assume you need longer than the 60 days. The assessment, yep, we could do another 2 months or 4 months. Will Medicare continue to pay these benefits?
Yes, so there's a few requirements to be eligible for home health care.
Okay.
And one of them is the doctor has to oversee, you have to have a doctor involved in.
Now, I would need the doctor or you would provide the medical director?
The patients that we serve would need to have a doctor.
Their doctor?
Yeah, their own doctor.
Okay, gotcha.
Any doctor
Gotcha.
Can oversee the care that we provide. The other one is that it is covered by insurance, and it has to be difficult to leave the home for the person. For us to be coming to their home and providing it there, the service there, it needs to be considered difficult for them to leave the home. Now, patients that we see go out to dinner with family, go to the doctor, go to the grocery store, but it's difficult, it's taxing, it can make them fatigued, or they need assistance to do that. They need someone to help them with their walker or their cane,
Right.
or
Right.
they need
Wheelchair.
someone to get them in and out of the car.
Right.
Those are the type of people that are eligible for us to provide that service in the home.
Okay. It's not just a matter of not having a car?
Correct, it has to be a physical limitation.
Okay.
Or sometimes a mental health limitation can
Okay.
qualify as well.
Okay.
That they need assistance to leave the home and that it's difficult,
Okay.
taxing for them to leave.
That's an interesting definition.
Right, and that's part of the Medicare's definition of when people are eligible for our service. And then the other caveat to providing services are that it needs to be something that people will make progress with the care that we're planning, or that we're maintaining their function or their medical condition. So you asked if after 60 days will Medicare continue to pay. As long as we are continuing to provide education and skilled intervention from our nurses and our therapists where we're seeing some progress, then yes, Medicare does continue to pay. And that's really up to us to do the
Determine.
documentation and work with the
Sure.
patient on that.
Is it possible that people use your service more than once? I have a knee replacement and need some help, and then I'm okay. Then I have something else happen and need some help.
Yes.
Or I'm a new diabetic, and that, so I can contact you again and again and again for these same services.
Yes, that happens very frequently where we have people calling us back for the same issue again or something different altogether. In fact, that just happened today. One of our previous patients called. She was recently in the hospital due to some heart issues she was having. She was discharged home with no home health services, which happens quite frequently.
I do not get that.
Yeah.
It has been shocking to me to hear stories of that.
Yeah. And she called and said she's really worried that she's not going to be able to do it on her own. She wants us to be able to come in and take a look at her medications because they gave her new medications. She's not sure which ones to take and when. She's short of breath, wants us to be able to check her vital signs and report that to the doctor because it's difficult for her to get to the doctor.
Sure.
And to be monitored as closely as she really needs to be with an acute heart condition that she's going through. So we saw her about 6 months ago, and she's been doing really well since then, but we're going to start services again here in the next few days after we get in touch with her doctor.
Breanna, what is your, what's your typical, I know this is always a horrible question to ask, but what is your typical client, would you say?
Great question. So there's so many different types of people.
I know, that's why I hesitated to ask.
To clarify it, so BAYADA services a lot of different types of people in the home, from kids all the way up to 100+ years old. In Ohio, we only work with adult patients and up to seniors. So
Up to or up through?
Through.
Okay.
Through. Up through the remainder of someone's
life.
But the different types of patients that we see would be somebody that is having a difficult time leaving their home, needing assistance, and has had a change in medical condition. So maybe they were newly diagnosed with diabetes or congestive heart failure. They go to the doctor, something new is going on, they're running some tests, and that person can get home health services in their home to be proactive about care to keep them from needing to ever be in the hospital. And that's really an underutilized service. So if somebody falls at home, they would be eligible to get physical therapy in the home if it's difficult for them to leave and just prevent.
Why don't people know this? I never knew this.
Yeah, well, there's just so many medical services out there. I think that, and doctors have to deal with so many different things when they're looking at their patients. Doctors are actually kind of undereducated about the adjunct and ability to use home health services as well. So it really comes from that, because that's how people learn what is out there, is from their doctors. And so it's been, you know, something as a home health industry that we've been continually working on.
I think that because people are in it, no matter the age or severity of their illness, seem to be in and out of the hospital in shorter and shorter periods of time.
Right.
And as a nurse, I spent most of my job doing education. Nurses can't do that anymore.
That is correct.
Not when you've got a 2-day window or a 3-day window with a new diabetic age 85.
Right.
And I think that is, it's become very sad that people go home and they don't know what to do. They can't remember the diet, or they mix up the insulin and don't know when to, for sure. And you know, many older people are reluctant to call the doctor and say, will you help me remember? I wish the doctors and I wish the hospitals would always recommend home health care.
Yeah, I think there's a combination of patients that are in the hospital often feel like they'll be okay when they get home too. Sometimes that happens where they're offered home health and at the time they think they'll be okay, but it's overwhelming for anyone, no matter what age you are or what you're experiencing when something new like that happens. So that we find that sometimes where we get phone calls after the fact saying, I thought I was going to be okay, but now I'm feeling like I need more services. And you know, there's a shortage of nurses, there's a shortage of case managers, discharge planning in the hospital.
There are.
You know, so people are leaving so fast from the hospital. Sometimes that piece gets missed, and people are discharged after hours where, you know, there's not someone to help coordinate the care that they're going to receive at home. So
hits close to home there, kiddo. I'm not kidding. With my parents, it was a real struggle. If you come in and you're at the 60-day mark and your nurse does not see progress, well, not just the nurse, but the PT folks and the team doesn't see progress, and do you ever have a period of time where you then question whether home health care is the right service, or do you ever recommend that someone go into assisted living or another environment?
Yes, we are always discharge planning from the beginning. We have team conferences on a regular basis to make sure that when our services are done, that there is a plan. We are really responsible for the care that's provided 60 days, 90 days. We are measured by Medicare, whether we're keeping people out of the hospital, even if we're not providing the service still. So we are held accountable to making sure that people have resources in place that are going to fit the needs that they might have. So we often make recommendations for different living settings, like assisted livings or independent livings, or getting people connected to other types of services that can be provided in the home, because it's a lot of burden on caregivers.
Yes.
And making sure
it's
that
hard to navigate this.
So we start those conversations as soon as we can with the patients and the families before discharging, to let them know we're thinking we have a few more weeks here. What's the plan when we're done? Sometimes people are completely back to independent and comfortable and don't need further services, and sometimes they do, and so we'll get them connected to those community resources.
Do you see people, I assume you do, who live alone and who live with a spouse or children? Is there an enormous difference in the kind of care that you see you need to give people who are in those? Does that make any sense? I would think that if I lived alone, I would rely on you more heavily. If I had my husband there, which I do, he would be able to help me with so much of my daily need after surgery, for example.
Yes, there's so many different types of caregiver assistance and support, though. So sometimes people have loved ones that live in the home, but they're not able to help.
Oh, I never thought
or
of that.
not, willing, or
I never thought of
are
that.
working their own jobs, or so. It really just varies. Each person is so very individual on what is their acute need that we are there for, whether it's surgery, whether it's a new diagnosis, whether it's pain that needs managed, wound care, and then what is that caregiver support, and that's definitely something that's part of the assessment to figure out how we can help support in the home.
Two last questions. One, I've heard older people be very, as we all are, I'm older too, I worry about who's coming in and out of my house. Mm-hmm. Do you have that concern ever expressed by your clients? Oh dear, this isn't the same nurse that was here last week, or the same physical therapist.
Yes. So we do a number of things. First of all, everybody that's employed with us has a background check. So we certainly make sure that that's clean. Also, the employees that we are sending out into people's home are all professional, mostly college-educated people. So it's a little less of a concern with our company.
I would imagine.
However, we know in doing home health care that you have to be very respectful of the fact that you're going into someone's private space. And so when we first make contact with someone to set up home health services, if we're feeling like someone's reluctant, we try to make it very clear that we're there to help. You're going through a difficult time, and we're not going to look at how your house looks, or you don't have to get ready for us. We're there to really help you through this very difficult time.
That's a very nice thing to say. That's very true, isn't it?
And have seen all kinds of different settings, and are fine with all of that. So. And we also at BAYADA try very hard to keep it consistent, the caregivers that are going in there.
That's what I wondered.
It doesn't always get to work that way, but we try to make sure that you're going to have the same physical therapist and the same nurse, and you start to get to know them, and become part of the family.
That really does happen. We have very limited time. I really think that for me, one of the most important things I heard about your truly wonderful company, I am so impressed, Breanna, but anyway, is the payment thing. That is flabbergasting to me. So I want you to just quickly speak again to Medicare and VA.
Okay, so Medicare pays for home health services 100%. There is nothing that's out of pocket, no copay, no deductible. If you have a managed Medicare product, there can be a copay or deductible. It's usually very small, and if you have a secondary insurance, that will pick that up.
Okay.
So most services that we provide in the home are 100% paid for, and that's because it's a benefit that you are entitled to as an adult and a senior that you've been paying into. We always check insurances before we provide care, and can tell you up front, and will tell you up front if there's any cost. Although usually it's minimum. And then the VA also provides home health services as well that are 100% covered. BAYADA is not currently in network with VA insurances yet, but we are working towards it. It's a contract that takes a while to get in place.
I would imagine it does. That's wonderful to hear. I had no idea. Thank you so much. The time flew by.
It did. It was fun.
It really did. I feel like we could spend another hour talking.
Right.
This again is Breanna Buterbaugh from BAYADA Home Health Care, a company that I had not heard of before. I'm just so impressed with what I heard today. If you want more information about this company, you know that you can send me an email and I will connect you with them. My email address is northofsixtyhctv@gmail.com. Thank you so much for watching, and thank you for being here.
Thank you for having me. It was a pleasure.